Hi, it's Eric Phelps here on behalf of the American Academy of Craniofacial Pain. We are preparing for the Airway Anatomy Forum in Santa Clara, October 24th and 25th. And I have an opportunity today to introduce you to Dr. Clara Ferrari, an excellent orthodontist in the East Bay, in the Bay Area. So Claire, welcome.
Thank you, Eric.
And the purpose of this conversation is to share with all of you what Claire will be covering. It's called the Airway Anatomy Forum. So we're going to be looking at anatomy from the diagnostic side, but also from the treatment, progress, result side. So part of my presentation will be tooth-borne expanders, and when we expand, how does the anatomy change? How does the nasal anatomy change? How does the maxillary width change? And what Claire's going to talk about is skeletal expansion and the anatomical changes she's able to achieve for patients with skeletal anchorage. So you'd like to share a little bit about that, Claire?
Yeah, thanks, Eric. We're doing more and more of our expansion using some form of MARPE appliance, and we're finding that it's very, very beneficial to patients, and we try to do our best to select them and not feel like, oh, skeletal expansion is for everyone. But the more I look at how we as humans are growing and just the skeletal record and what has happened with industrialization, it's kind of amazing how many people would benefit from some kind of skeletal expansion. And we feel really comfortable placing the appliances now, and it's been quite a learning curve. And I just feel like it's very, very beneficial for so many people, and it would be great if, more people felt comfortable doing it. And if we could have another tool in our toolkit that could certainly help kids not have sleep disturbed breathing, but also adults, because it has such a big impact on our health.
Well, I appreciate all that you've done in this field, because it takes people like you that are willing to step out there. And like you, what we've experienced is some of these incredible results, not just in how teeth fit together, what the smile looks like, but the changes in overall health and quality of life because they're breathing better. And I think a message from this forum is going to be, what does the periodontal ligament do? If you're tooth-borne and you're pushing on teeth and you have that periodontal ligament in the middle of what you're trying to control, how does the remodeling of bone happen around the teeth? So I'm hoping between my presentation and your presentation, we'll see from our patients the skeletal changes that are different between the different modes of therapy. So I'll just ask this because this is what I experienced. Sometimes you treat a patient and go, oh, I wish I would use skeletal expansion, right?
I say that often, Eric. And in fact, some of the cases that were most enlightening to me were ones that I did regular phase 1 expansion. You may not even call it regular. It was like phase 1 expansion for someone who has airway issues using a tooth-borne appliance. And then we assess. We're always assessing after we've done our work, how are they doing? And this patient still had, number one, if they still have crowding, that's a data point for us. But if they still have some sleep disturbed breathing issues or difficulty breathing through the nose, then we will go ahead and do more expansion with a bone-borne expander. And when I was superimposing the images and I could see this is what happened after a year of phase 1 with a tooth-borne expander, and this is what happened after 4 months of a bone-borne expander, and this is what I see happening for the patient, how much better it was, it definitely is informative. It's educating me about what would I want. And then when I was asked to write this book chapter for a textbook that George Mendeleris did, and I had to do the research on what are we doing with tooth-borne expanders, and what you were just talking about, the periodontal ligament, what's happening to the teeth, and it is very age-related as well. But I could see what is the literature showing around tooth-borne expansion versus bone-borne, and that's the kind of information I want to give to my patients so they can choose. And it is not uncommon, Eric, that we do tooth-borne expansion in phase 1, and we have a conversation when they're ready for phase 2. And it has to do with how are they feeling? What's their health history forms show? What's their ability to breathe through their nose? What's their family history of sleep apnea? And say, this is our time that we could make the maxilla wider, even if they don't have symptoms sometimes, and just give them the opportunity. And what I said to them is, I feel like this is a gift I'm giving you. And if you don't want that gift, you just say, no, thank you. It's more like it's an opportunity, not some kind of horrible thing that I want for them because I see everyone the same way.
It takes years to get to your level of understanding. You'll be able to share this at this forum, and I think people will be able to gain from years of experience that you have in this. It's really a specialty within the specialty.
That's what it feels like. That's right. It's kind of it's like a subspecialty of the specialty. And there is definitely a learning curve. There's a steep learning curve. And what I would love to do is kind of shorten that learning curve, because there is a lot that was learned in these 10 years, right? And there's also the learning curve of the people who are making the appliances, right? And the tools we have now are much better than they were 10 years ago. So that's been a game changer as well, just the design of the appliances.
Well said. Well, I think that gives enough info for those of you kind of interested in the forum. We hope to have you there. We hope to have a couple hundred people there and all learn together and have a really great experience. We have ENT, psychiatry, sleep medicine, oral surgery, orthodontics. There's a lot going on to have everybody under one roof. Please come join us. And thank you so much, Claire, for your time and for committing to this event.
Thanks for doing it, Eric. It's important work.